Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by pandemic expert Dr. Carlos Del Rio, who's the Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Dr. Del Rio, it's great to see you this week.
It's great to be with you, as always.
All right, let's get going. A lot of questions already came in, and we're going to start with this. What is the biggest concern about the state combining antibody and antigen testing data? Does it skew numbers and make it look like lower percentage of new cases? Can you talk about that?
Well, you just can't combine that. I was recently, I just put a tweet saying that combining, antigen, that the RNA test, the molecular test with antibody tests is a little bit like counting your chickens and your eggs, and then saying my coop, my chicken coop is, you got 80 chickens and 20 eggs. You cannot say you have 100 animals in your coop. Those chickens and eggs are different things. So ideally, we should know the antigen test, the molecular tests that are positive, the RNA tests that are positive, and once we have the antigen test, also the antigen test. But the antibody test mostly is telling us about. It's useful from a public health perspective to know about how percentage of the population has been infected, but it doesn't talk to us about active infection. So it's not very useful to know where new outbreaks are occurring. And I think it'll be nice. It's important information, but the state should disaggregate that and give it as a separate information.
Okay. Now the CDC is saying COVID-19 doesn't appear to spread on surfaces like previously thought. I find this very confusing. What are his suggestions for people?
I have not seen that from the CDC, so I need to look on that. I mean, as early as this morning, it was pretty much spread by surfaces. So if that's what CDC is saying, I need to look it up.
Okay. Yeah, there were new guidelines that the CDC came out with that said that people don't have to worry as much about the surfaces, and it's more person-to-person contact.
Again, it may be more person-to-person, but I think I still worry about surfaces, and I worry about the high contact surfaces. Our experience with coronavirus is that high contact surfaces tend to be very important. In the SARS epidemic in 2002, that now seems like a long time ago, there was a famous outbreak in a place called the Hotel M in Hong Kong. Hotel M in Hong Kong had several people infected. They were all staying in the hotel, but they were not in the same floor and they were not in the elevator at the same time. They were not part of a group. And the only explanation is they were all using the elevator, and they were probably touching the button on the elevator, and they were probably then touching the button, touching your face. If you remember the movie Contagion, that is played in the movie Contagion.
Interesting. Another question. I look at the GDPH website every day. The daily counts for deaths are constantly changing both up and down, sometimes going all the way back into March. I'm talking about deaths for a specific day, such as April 4th. Ditto for daily positive test, though they appear static for days prior to April. Does it make sense that there would be lags going back 8 to 10 weeks? What's the deal?
Yeah, there's probably lags going back that long. Unfortunately, the public health information systems are not as quick as you would like them to be. I wish they worked more like your banking system. But the reality is that, it relies on each health department. Well, here is, somebody dies, so you need to create a death certificate that then goes to the Department of Public Health, that then transmits it to the Department of Health. They need to check on the data. So it's a very manual and time-intensive process that also requires a lot of data checking and data assuring. So, having done research for many years, sometimes when I need to see if a participant is dead, frequently you have to wait several months to look at the national database to see if indeed they appear there. So it's not instantaneous information.
Okay. Are daycares safe under new Kemp guidelines of up to 20 kids per class?
We don't know. We will know once we implement those restrictions, right? I mean, I think, again, we have never had this. So we're making these decisions based on best available science. But I think what we need to do is we need to see what happens. Now, it may be safe if no kid is infected, it's fine. But if one kid is infected, you can have transmission. So the issue is just what goes into the mix. You can have 100,000 people in a stadium. If nobody's infected, there's not going to be transmission. It's not due to the number of people. Simply what increases is the probability that somebody's going to be infected, right?
Right. And I also think about social distancing with 20 little kids.
Well, I don't know how you implement social distancing with kids. I mean, with babies, yes, because you can put one here and one there. But once they start running around, I have no idea how you do social
Yeah.
distancing.
No, me either. Would you tell your wife it's okay to get her hair cut, colored, and blow dried?
Oh, that's a tough one. But I guess if you go to a place and they're wearing masks, and can you get your hair cut with a mask on and do the appropriate thing? Probably. I mean, again, it's really about taking all the appropriate precautions, and we cannot underemphasize the importance of masking, the importance of eye protection, the importance of hand washing. I just cannot underemphasize the importance of doing all those different things.
Do numbers going in the right direction mean we are handling this correctly in Georgia, or do you expect a hike and therefore setback statewide?
I think what we are seeing is things are going okay in Georgia, but again, is the entire state. You need to look at specific parts of the state. Things in the chicken industry and up in the Gainesville area are not going very well. Things in some of our nursing homes and long-term care facilities are not going very well. So I think overall, I think things are okay. But quite frankly, I still see a lot of places are closed. A lot of people are still practicing social distancing. So my plea to everybody is, yes, this is not over. Continue doing what you're doing. Go about, and maybe you can go out a little bit. Start slowly going out, but don't say this is over and I can go to a bar with 10 people, because we have seen outbreaks, and you're going to be seeing significant outbreaks, and you cannot be sure that this is gone, because it is not.
I have family members who were sick in March. They took the antibody test and were positive for the antibodies. When is it safe to be around them again?
It's probably safe to be around them now. We know that somebody who has the disease, about 10 to 14 days after they had it, they're no longer infectious.
Okay. My wife has had 4 positive COVID-19 tests, 1 throat swab and 3 nasal swabs. The 3 nasal swabs came from the hospital that she works at. Any thoughts as to why we are going on 2 months of her showing positive?
Again, the positive test talks about the presence of RNA of the virus, is not looking at the whole virus. And we have some fairly good recent data suggesting that after 10 to 14 days, even though the test may be positive, this is just not is pieces of virus in your nose. You're not infectious anymore. And this is something we need to understand better. CDC and others, a lot of scientists are very interested in understanding what happens. What is that some people tend to do this? It's not everybody, but it happens.
What do you think about the latest guidelines for schools opening in the fall? If you oversaw the process, what guidance would you offer on educating students? And thank you for taking the time to speak to us each week.
Well, I think that, we're all working on what to do with schools. And as you said, it's very different to think about a pre-K school than it is to think about a college, than it is to think about a high school. I think you want to do several things. You want to educate students. I mean, once they got to be, high elementary or junior high or high school, really talk to them about the importance of social distancing, about wearing masks, limit class sizes. I would say, think about class sizes in the 10 to 20 range at most. Continue doing as much as you can through distance learning, remotely, but some things you have to be in class and therefore do there. I think one thing that I would definitely tell schools to avoid 100% at this point in time is chorus. I think chorus is a dangerous activity. I think we've shown in several studies in churches and in other settings that choruses are a place where a lot of transmission can occur, because if somebody's infected, the way you sing, et cetera, the transmission is very rapid and quick. So certain activities, I would say, are simply no-nos.
Mm-hmm. Delta and other airlines have implemented changes because of COVID. How safe is it to travel on an airline?
Well, I think that everybody's trying to make it safe to travel. I would say that my niece, I tell this example to everybody. My niece lives in Milan, and she recently got evacuated after being in Milan for almost 10 weeks after Milan was locked down. And she a couple of weeks ago left Milan, and she flew from Milan to Amsterdam to Mexico City, and we made sure she had mask and goggles and hand sanitizers and etc. And she's now more than 14 days after she returned, and she's fine. So she avoided getting infected. So I think it's possible, and this wasn't a short flight. I mean, this was 14 hours, 15 hours of traveling, and she was able to avoid. So I worry about the airline, but as long as you have your mask and you do that, I think it's fine. I also think that having eye protection is probably important.
I was going to say, I noticed that you said she wore goggles, which makes me.
I think eye protection is important.
Yeah.
Whether you wear glasses or you wear goggles or you wear something, and I also worry about when you're checking in, security, those kinds of places where you try to do some social distancing, and again going to the restroom. So I think we all need to be. I think it's possible, but I think you just need to. It's going to be different than what it was before. But think about 9/11. What we started doing in 9/11 are things that we never imagined, and now we do them, and it's pretty regular.
Right. I was sick back in March and had all the symptoms of COVID-19, except my lungs were clear, so the doctor didn't feel the test was necessary, especially since there were so few tests available back then. Would there be any reason to get an antibody test other than being able to donate plasma? I would gladly do that. I'm not sure whether or not to waste people's time in getting the test because I might have had COVID-19 back in March. Fortunately, it was short-lived.
Well, first of all, I want to thank you for being thoughtful because, to think about, I'm not going to waste tests, I'm not going to waste people's time. Thank you. You're a very generous person. I think it's important, at some point in time for you to get an antibody test. First of all, you may be a donor, but more importantly, just to know that you indeed had it. I can tell you that I was in Vail in February. There were a lot of people got infected in Vail. Mm-hmm. And after returning from Vail, I had a pretty bad cold. So I said, for sure I had COVID. I just didn't realize it. And I checked my antibody test and I was negative. So whatever I had coming back from Vail, it wasn't COVID.
Oh, interesting. This weekend, I drove through historic Roswell where restaurant patios were packed. I counted 2 people wearing masks in the crowded spaces and no social distancing. I'm assuming because they were outdoors, people feel they can disregard social distancing. Are we at the point where we can sit in close proximity in outdoor restaurant spaces without concern?
I mean, several things. I think yes, and no. In other words, it's good that we're outside. And again, thinking about the summer, it's good that we're outside because there's less transmission when you're outside. There's more wind, but there's still the possibility of transmission. So I still think that, I would still practice some social distancing. I will still be careful. I wouldn't be, in an outside patio with hundreds of people without a mask. I would not, even with a mask, I'd probably not feel safe.
Right. Because we've talked about this for weeks. Even if you are wearing a mask, if the people around you aren't wearing a mask, you're still essentially exposed.
The only reason you wear a mask is to protect others.
Right.
So everybody needs to wear a mask.
Okay. This is a follow-up question, I guess, from air travel. Who has goggles, like swimming goggles? I will tell you that when we talked about Dr. Fair, the epidemiologist, who believed that he caught it through his eyes traveling to New Orleans, I was wondering the same thing because my family was supposed to go to Europe in a couple days, and I was picturing all of us getting on a plane with our swim goggles. I mean, obviously we're not going.
I think if you wear glasses, that offer some protection. Swim goggles will be okay. Ski goggles will be fine. Remember the scene in Notting Hill where the guy was using the goggles because he
yes,
can't find his glasses?
Yes.
Well, I think you can get your ski goggles and put them on. A swimming mask. You can take. There's some great videos about how to make a face shield. You can take literally. There's some great videos about you can take one of these plastic covers of folders that you use at work, and you make a headband and you put that there and you can use a face shield. That's fine.
I love it. I'm sorry. I'm not laughing at it. These are good ideas. I'm just picturing what it would be like to travel and some of the interesting fashion eye choices we'd be seeing.
I think wearing, some very good epidemiologists at Iowa, which is one of the best places that has hospital epidemiology, hospital infection control, wrote a piece in JAMA about, and people can look at it, just Google JAMA COVID goggles and you'll see it. It's a two-page short piece talking about how we should all be wearing eye cover out because it's a great way to protect ourselves. And the nice thing about wearing an eye cover that covers you all the way around, including your mouth, is that you don't need a mask, right? You can just cover that.
Yeah, that's a good point. Can you please clear up the confusion over antibody testing? Finger prick versus blood draw. What do you learn from the test? What if I have or don't have the antibodies
Well,
now?
lots of things to clear.
Yeah.
Finger prick just, gets a little dot of blood, small amount. Blood draw, you get a needle, get more blood. It's just the difference between getting a drop versus a tube, but it's still blood. Getting a tube is better because then the lab can separate it and separate the serum or the plasma from the red cells, so you have less interference. So in general, a blood draw is better than a finger prick.
Okay.
Then you have the type of test. And there's many, many types of tests out there in the community, and some are better than others. And I think part of what we need to do is make sure that the test being done is the correct one, and it's a good test. And there's some that are better than others, and the FDA is trying to make sure that the ones that are out there are the correct ones, but make sure it's a good test. And the tests depend on what kind of antibodies are measuring. And so there are some tests that are measuring antibodies, but are not necessarily showing evidence of protection.
Okay. What are your thoughts on healthcare workers who've tested positive multiple times, 4+, with presumable false positives? This is not allowing the healthcare workers to return to work because of a positive test. Can you discuss the accuracy of the testing with false positives?
I think, again, those are not false positive. The test is positive, but it may not be infectious virus anymore. So that may be the issue. We, in many places in healthcare, are actually, because of that, are saying if somebody, we're all wearing masks in healthcare, so basically it doesn't really matter if you tested positive.
Right, good point.
Because after 10 days, you can come back and just wear your mask.
Right. How is the public health system infrastructure going to change from the lessons of this pandemic?
Well, I sure hope it changes dramatically, and I sure hope we have more investment. I sure we have more equipment. I think we need more support, and I think we need to understand that public health is critically important. We, in this country, have spent millions and millions in care infrastructure, and we haven't spent that much in prevention infrastructure. And I think we need to start thinking prevention. And if anything comes out of this pandemic, it's not just talking about public health infrastructure. It's talking about prevention infrastructure. We need to be sure that people get preventative care for their diabetes, for their hypertension, so they don't come to the hospital with a stroke. They don't come to the hospital with uncontrolled diabetes. And with that, what we require is to be able to do preventative care. And that means you have to have access to care in order to have preventative care.
Yeah. What is known about COVID mutations? Is Emory following or doing research on mutations?
All viruses mutate, and I think everybody's interested in understanding how virus mutates. Viruses do this all the time, and especially viruses like this one, RNA viruses, do this. I would worry less about the mutations right now. I think right now the mutations are useful to help us understand how the virus got here. So if despite everything you hear about the virus coming from China, more likely the virus that came into the US, most of it actually came from Europe, from Italy, primarily via New York. Again, a lot of traffic from New York to Italy. So, and that was determined because of mutation, because changes in the different types of virus. So a lot of molecular epidemiology can be done by looking at mutations. It has less relevance as far as treatment and other things.
What is the process by which COVID becomes endemic, less harmless? A buildup of immunity in the population, or does the virus mutate to become less virulent? Given what we know about COVID now, how likely that we are close to normal in a year or two?
I think it's a combination of both. The virus can become less virulent, less transmissible, less capable of transmitting human to human. But the other thing that can happen is that we can build this community immunity, this so-called herd immunity. The problem is herd immunity for a virus like this one is going to take a lot of work. In other words, you're going to probably have to get to about 60% of the population infected. And in order to get 60% of the population infected, right now we think in the US maybe, 10% of the population is infected, and we've already had 90,000 deaths. So think about going from 10% to 60%, so that's 6 times that. So just multiply 90,000 times 6. That's 500,000 people dead. So, we can get there by infecting other people, but the human cost, the life cost, will be, in my mind, at this point in time, unacceptable. So we need to wait for a vaccine for that to happen.
What about vitamin D deficiency?
Vitamin D deficiency is bad, but vitamin D deficiency has been associated with a lot of things. And when we correct vitamin C deficiency, we rarely see an improvement of those things. So just because there's a deficiency doesn't mean that improving it is going to make it better.
Okay. Thoughts on working out in gyms?
I'm not ready to go to the gym, let's put it that way. I think that maybe if I'm going to be in the treadmill, and I haven't gone back to the gym, but are they going to put some shields around it? Are going to, maybe it's okay. But when you're running, when you're in the gym, you're breathing fast. It'll be uncomfortable to wear a mask. And, there's a lot of, splashing of sweat and other things. I'm not ready to go to the gym.
Thoughts about swimming in swimming pools, please?
Well, again, swim, less likely that you're going to get transmitted in the swimming pool. The water, you're in the water has chlorine. So if you're in the swimming pool, I worry less about the swimming pool. I worry more about when you get out of the swimming pool. And if in the swimming pool deck, there's hundreds of people, and then you meet a friend and you start talking, that's when the transmission can happen. Swimming, it's okay.
Is it safe to stay in an Airbnb, and I'll throw in with this, or any rental vacation property?
Again, do the appropriate cleaning, and you'll be okay.
Mm-hmm. Is it safe to go swimming in a lake?
Again, I'll say the exact same thing. It's with whom, how many people, you're going to go swimming with a lake by yourself? Yeah, that's probably fine. You're going to go swimming in the lake with 100 of your best friends? Probably not a good idea.
I was standing on the sidewalk outside my house, not expecting to run into anyone, so was not wearing a mask. 2 young joggers, huffing and puffing, ran past me. If they were COVID-19 positive, would I be at risk? I'm referencing that study about droplet contagion and exercising.
I think you could be at risk. That doesn't mean you got infected, but I certainly think you could be at risk. And that's something that's why hopefully I would hope that joggers avoid jogging by somebody, precisely because of that.
Have hospitalizations declined in Georgia?
They are stable. They haven't declined as much as you would like them. They're at a steady state. We still have, a significant number of people in the hospital and in the ICUs.
We hear a lot about how to protect ourselves from COVID. What do we do once we recover from COVID? There is less information out there on what precautions individuals can take after COVID. Since we don't know about immunity, do people still wear masks, etc.?
I would probably still wear a mask, but I would tell you that likely you're immune. I think that more and more we're learning that you're probably immune.
There is a question on here. I don't know what this stands for, Dr. Del Rio. Can you update us on cases of MIS-C in Georgia? Do you know? What that MIS-C. I'm sorry, I don't know.
I don't know what they're talking about, but.
Okay. All right, no worries. You know what? Are there updates on the cases of MIS-C in children in Georgia? That's that probably multi-inflammatory system thing that people are dealing with.
That probably has to do with the Kawasaki disease. And again, it's an inflammatory process that we see in children. It's interesting. Again, we didn't think that this disease impacted children. And we learned that it does impact children, but children are rarely sick. But a few children can actually get very sick and can develop this inflammatory process called Kawasaki and end up in the hospital. And the reason I say that is because I've heard many people talk about having COVID parties and bringing their kids and getting them all infected. Bad idea, because they can get very sick and end up in the hospital.
Can people who have recovered get sick again?
We think it's unlikely, but in any infectious disease, you're not going to have 100% immunity.
Would you consider an elective procedure in an outpatient procedure now, if they do not allow you to wear goggles or mask for the work?
I think depends what elective procedure is and what you need done. I think that's a decision I think healthcare systems are doing a very good job of trying to prevent infection.
How long does the virus stay in your immune system?
Well, it doesn't stay in your immune system because again, it stays in your body and then you clear it. Your immune system helps you clear the virus.
Do you feel that all citizens of Georgia should eventually get tested, or that just healthcare workers should be tested?
I think anybody that needs a test should be tested. I think if you think you have the disease, you should be tested. I think if you're in a contact of somebody who has the disease, is a close contact, I think you should be tested. I think we cannot underemphasize the importance of testing.
This is a question I think a lot of people relate to. Can he give tips for people having trouble sleeping due to anxiety? Well,
I think we're living in a time of a lot of anxiety, and there's a lot of anxiety because there's a lot of uncertainty. There's a lot of, I think we get nervous about our lives and about what's going to happen, both in our world, in our jobs, in our financial stability, and that creates anxiety. I think there's a lot of things that people can do to anxiety, from going out on a walk. I tend to try to walk in the afternoons or in the morning just because it really helps me clear my head and relax me. You can listen to music. You can do yoga. I think we all have different ways of relaxing and doing some meditation. But at the end of the day, find time to relax, and find time to also think that to think positive. Because I think if you start thinking about all the bad things, you could be overwhelmed very rapidly.
Well, that brings us to the end of our Facebook Live. And what's interesting, Dr. Del Rio, is a lot of people will send me private questions and private messages because they don't want their names out there. And I definitely saw a theme this week. A lot of people talking about we are coming to the end of the school year, a time where whether you have children or not, you get ready for your summer vacations, weddings, get together with friends, date nights at restaurants, going to the movie theaters, all the things we've taken for granted in our lives. So we're not going to be having a normal summer, and people feel sad about it. So we have this stretch of time before us. What is your best advice, putting you on the spot, for how we can continue through this? And I'll say one other thing. One of the most common things people say to me is, it would be different if we knew when this was going to end. And that uncertainty, it just is like a big cloud of heaviness.
So, I think people need to read history, and we need to understand what human suffering and what uncertainty has been. And I was the other day thinking back to the siege of Leningrad, and the number of the 100 days that the Germans sieged the city of Leningrad and prevented people from going in, food, and were hammering the city with guns and tanks and cannons, and yet the people there were incredibly resilient, and thousands died, but those that survived made it. Right? They recovered, and I used to know a person that actually she's no longer alive, but when I knew her many years ago, she was a survivor of Leningrad, and she was a young nurse back then, and she would tell about her story, and she actually wrote it in a book that I would recommend people read. It's called Zurich, and it's her life as a young nurse meeting this kid who had been orphaned and how she helped this kid. And I think one of the things that she talked about is stay busy, stay focused, think about the greater good, think about what you can do for others. I think it's really important in thinking about what you can do for others, because that helps us emotionally and internally. If you're helping others, if you're doing something for others, and if you're financially, emotionally, that will be good for you. And think less about ourselves and about how bad it is that I'm not this summer, but think more about when this is over, the things that we can do and how we can celebrate. Find out those little pearls of happiness in life, that sunset, that beautiful afternoon, that great movie that I want to see again. Thank God for Netflix and other things, right?
Yeah.
And again, think about those times of resilience in which think about Pearl Harbor. Think about those times in which we as a nation rose and confronted an enemy and defeated the enemy. And I think that what you would learn is that we can do it, and we need to work together, and we need to bind together, and we need to unify, and it will take sacrifice, a lot of sacrifice, but we will get over this. I can guarantee you we'll get over this. This is not the end. So what we do and how we do it and how quickly we do it is in our hands. So we need to really bind together. We need to think positive, and we need to not give up.
Thank you, Dr. Del Rio. I really appreciate the ends of our talks, and I know that so many people who tune in each week really value your advice and guidance. And I will tell you, I always enjoy every night on Twitter when you put on what piece of music you're listening to. So I know one of the ways that you find your peace too in the middle of this. Thank you. Have a great Memorial Day weekend.
Have a good weekend.
And we'll see you soon.
Take care.
You too. Bye-bye.
Bye.
All right, everyone. Be well. See you soon.